I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. We're coming to you from the Kramer Davis Health Clinic in Nashville, or right outside of Nashville, and our guest today is the clinic director, Meera Gandhi.
Hello.
Welcome, Meera.
Thank you. I'm so excited to be here.
Thanks. So, Meera, tell me about your experiences, or how did you end up coming to become the clinic director for Kramer Davis Health?
Great question. So I have actually always been passionate about the IDD population. It started when I was 15 years old, and I was actually a coach for Special Olympics over at City of Lakewood Parks and Rec. Shout out there.
Which is where?
In California.
California,
yes,
okay.
Yes. And I just found my passion for this population. There's nothing like the humility of these athletes and the complete bravery in everything that they do. And, you know, ever since I was a child, I wanted to be in medicine. And so I continued my career through the years in various ways. So I became a Special Olympics Global Messenger, mentor for Dustin Plunkett, who has an absolutely incredibly story on how Special Olympics healthy athletes saved his life. And so we traveled the world for Special Olympics, delivering his message. And it was beautiful. And from these experiences over at the World Games in China, I met Matt Holder, Dr. Holder.
And Matt's one of the co-founders of
he's the CEO of Kramer Davis. And he became my mentor over the last 20 years. And I wanted to be a doctor. And then I decided, I think I need to be a PA because it works in a better work-life balance. And he was kind of there every step of the way. I continued to develop my career in Special Olympics as a clinical advisor or clinical director for MedFest. And I did health promotion as well, and organized events and partnerships through Duke University, where I became a PA and collaborated with Urgent Care and Special Olympics North Carolina to deliver these amazing events that gave free physicals to athletes. We created dances, and it was just a wonderful experience. I continued in operations for Everything ALS, which is a neurodegenerative disease group, and developed a lot of operational skills. And so when Dr. Holder asked me to interview for this clinical director position, I mean, there's nothing in my life that I would have wanted more. An opportunity to change medicine is really how I look at it. And Kramer Davis is doing that. So that's why I'm excited to be here. And that's how I got here.
That's a great story. And you were very succinct in telling that story. That's quite a skill. So you mentioned changing medicine. How is Kramer Davis Health changing medicine?
Wow. Gosh, I'm a hand talker. So
that's okay.
I want to. So typical medicine, you have your doctors, you have your primary care doctors, and, they don't talk to the dentist. And, do we talk to the physical therapist much? Where is psych? Do we have the right insurances? Even if we put that referral in, does the patient go to the appointment? Do they have the transportations? Are we addressing their social determinants of health? Are we talking to that other dentist, physical therapist to collaborate that care?
And the answer for the most part is no.
Yeah,
it's not happening.
It's not happening. And at me as a, PA, practicing PA, I still struggle with those silos. Like, how do I find the right referring specialist? How do I find that? And so you can only imagine that in this population of IDD patients, it's especially difficult. And then you add in transportation issue. You add in, do we have the right conservators? Do add in potential neglect? I mean, there's so many things to consider. And Kramer Davis is a way to have all of it housed in one clinic. I mean, we're 20,000 square feet here at Kramer Davis, and we have our medicine, our dental, our therapist, our psych, our behavioral analyst, who we encourage curbside consults. Whereas in a traditional hospital, the primary care is not easily talking to the neurologist or someone or the psychiatrist. Over here, we can just go down the hall and say, hey, do you have a second to pop in this patient? In addition to that, every single week, we hold these clinical roundtables, and we discuss our most complicated patients, our patients that need us to go above and beyond for their care. So we create a list of all of our challenging patients, and we discuss like what are ways that we can all work together to establish the core goal. And that's how we're transforming medicine. We're giving them this holistic approach.
Yeah, so that fits in perfectly with what we talk about a lot, integrated care, fully integrated care. You know, there's different levels of what we call integrated care, co-location, where people just kind of are nearby, but not necessarily communicating very much. But you're really speaking of fully integrated care, which is essential, in my opinion, for people with intellectual and developmental disabilities, but it's certainly a wonderful model for healthcare across the board. Don't we, you know, all of our minds are connected to our bodies and to our teeth.
Yes. Dental is a huge unmet need in our patient population, especially this one.
And having you know, the same group of clinicians seeing people from their own perspectives, but then also coming together to talk about that person as a whole person.
Exactly.
Certainly sounds like a great model.
Oh my gosh, it is. And we also work it's a very individualized patient approach. So say someone is driving 3 hours to get here, we're going to try to get them in with every single appointment that we can get. Oh, you want to see medical, PT, OT, SLP? Okay, let's get you all in straight back to back. Oh, you need an hour break for lunch? Sure. Do you need a behavioral analyst the whole time to help you manage getting through these appointments? Yes, we can certainly offer that. And so we create a very individualized approach that facilitates whatever it is that the patient needs.
Yeah, if they only need one aspect, then they can get that. But many times we know that people with IDD have some complexities that are all very interrelated. Yes. And I think the other important aspect is you have clinicians who understand healthcare for people with IDD, which we know that that's a challenge in terms of many clinicians, just like I wasn't educated in providing healthcare for people with IDD. You know, we all could use a lot more. And here you have a group of clinicians who understand the specific healthcare needs of people with intellectual and developmental disabilities, which certainly a good thing.
Yeah, I couldn't agree more.
Did you have training when you were in PA school related to IDD healthcare?
I value the education that I received, but unfortunately, medicine for IDD is limited to minimal to none, maybe an hour. I mean, you talk about some of like Down syndrome, some chromosomal abnormalities, but for the most part, you're not really receiving an education. But what I did do while I worked at Duke Urgent Care was partner with Special Olympics International to create a curriculum for PA schools. And I actually gave some education to, you know, Duke PA program and I believe a few others in the area to kind of discuss health, inclusive health.
That's fantastic that you took that initiative. I had the opportunity when I was in Mississippi to develop a relationship with the PA school there and started doing some lectures on IDD healthcare. And I thought it was great that they were interested and welcoming and wanted to receive that information, because it's so needed and it's so important. And I always tell people, you know, when we're talking about training in a particular area, if you go to a clinician that wasn't trained in something, your outcomes may not be always necessarily great, right? Like if you came to me as a family physician for eye surgery, you go blind because I'm not trained. It's not that I don't care. It's not that I'm not interested, but I just wasn't trained. And I think, you know, for a large part of the population that are seeing clinicians of all levels, you would like to know that your clinicians are trained to meet the healthcare needs of everyone, including people with disabilities. And I think we've got room to improve on that in the healthcare training world.
I mean, I couldn't agree more. If a patient with IDD or for honestly any complicated patient goes into urgent care, ER, very often we're not we don't understand that patient quite as much as, you know, people that are specifically trained in this area. And I'll admit that polypharmacy happens. I mean, it's just, it's the name of the game. It's, you know, this patient is nonverbal and he's reacting, and then maybe he gets admitted into the psych ward and inpatient, and, you know, perhaps it was just something so simple.
That's a great category of examples I like to give is an adverse behavior that we see in someone who maybe can't tell you what's going on verbally. And that gets seen as aggression, or, oh, that's just what that, you know, people with IDD do. So we need to put them on a medicine to calm that behavior down. And the whole time they might be having, you know, a gallbladder problem, or constipation, or a dental problem, or, you know, something else that's treatable and fixable, but they don't have necessarily the way to express that by saying, oh, my stomach hurts. But so they become agitated, or they don't want to eat, and maybe there's some aggression involved, and you end up with something we talked about called diagnostic overshadowing, where we just attribute, you know, their physical symptom of, say, aggression in this case, to their overall diagnosis, rather than looking for a treatable underlying cause.
And the struggle after that is, when someone sees this patient, they're reluctant to remove this medication from their list. And so we continue to give it year after year, we as medical professionals. And no one wants to remove this medication because at some point, someone definitely wanted it. And no one wants to mess with psych medications.
You're right. And sometimes it may have been for an appropriate reason for that particular time period, but it's not needed anymore, but the person stays on it forever. And then sometimes they're put on it and it really wasn't the right thing in the first place.
Yeah, and I'll also say that Kramer Davis, part of our initiatives is to reduce that polypharmacy. We have not been open very long, but we've seen so many cases where we are reducing the medications that people are on, and we are seeing, I'll give you a direct quote from a patient's mom. I have not seen my son in years. This is the first time I've seen my son. He's here with me. And and she's in tears. And literally this was last week. And it warms my heart to know that our team here is doing everything they can to get our patients to a better quality of life that perhaps they had years ago.
Yeah, and that's the kind of difference you want to make as a clinician. Yeah, it's great to hear those stories. I had a similar experience years ago with someone who was on multiple meds, and as you know, like, well, do these really need to be there? And you start backing off, and that person who I had never heard speak before started speaking. Wow. And I was like, whoa. And you know, and nothing got worse medically. I mean, they were on lots of meds they just had been on and stayed on for years, and that person became much more alert and was actually speaking, and it's quite humbling when you see that, and you think about somebody who's been, you know, maybe oversedated on meds that they didn't necessarily need for years. Yeah,
I couldn't agree more.
Yeah.
I mean, you're just preaching to the choir.
I know, but you know, one of the reasons we're doing this as a podcast is to help get these stories out and these messages out, to help emphasize, you know, in healthcare, why is it so important that we train our clinicians, you know, about providing healthcare for people with IDD? And another aspect of this podcast is to help people see this field as a field where they can have a very rewarding and fulfilling career.
Oh, I couldn't agree more. I think, honestly, it takes a special person to care about such a complex group of people. But the thing is, we can do so much more training on the front end that this actually is not a specialized thing. This could just be the norm of providing excellent care to these patients. Yeah. But it's so rewarding to see patients regain more function, more activities of their daily living, more ability to express themselves. And this is something that perhaps we take for granted because it just comes so easy to us.
Yeah, agreed. So what are some of the other things about Kramer Davis Health that you'd like people out there to know? Let's start with, for instance, let's say someone wants to learn more about Kramer Davis Health and what they do. where do they go?
So kramerdavis.health, and that's kd.health. And you can access our entire website. From there, you can either become a new patient, request a tour, refer a patient, just request more information. And also, there's career opportunities at Kramer Davis, and we're always looking to expand. And honestly, part of our purpose here is to spread awareness for this population. The more people that we can train and get visibility, the more care these patients can get.
So I know Kramer Davis here in Nashville is just kind of getting started, but are there opportunities for people to come, clinicians, to come and spend some time? Are you looking to add that in the future and learn and have like an internship type situation?
Yeah, great question. The whole purpose of Kramer Davis is not just for the patients. We need to really focus on the clinicians because we're one clinic. We can do this one unit in time where we are all seeing these patients, but the whole purpose, the way to exponentially increase the care for this patient population is to educate and train. So we're developing Kramer Davis Learning Institute to help educate. And of course, we want to take students, we want to take interns, fellows, residents, all of the above, PTOT, all the students. But just because we're starting out at this time, we're not accepting them right at this moment. But once we get our workflows down and succinct and kind of our flow going, we're super excited to have all of the learners.
Yeah, those will be great opportunities for people out there and for clinicians out there to come and spend some time and learn about healthcare for people with intellectual and developmental disabilities. Yeah.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escude, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. So, Meera, one of the things I like to do is I like to ask guests to tell us 3 things in 3 minutes about, tips, words of wisdom, pieces of advice that you think can improve health and wellness or the world of supports and services for people with intellectual and developmental disabilities.
Okay, 3 things, 3 minutes.
Yeah, I won't hold you to the 3 minutes, but I will hold you to the 3 things.
Okay. Number 1, I think this approach of transdisciplinary care, this is a huge aspect of medicine, and I don't know how to do that for every single healthcare, like every single place in our nation, but there's such a value to talking so frequently, having the same EHR system between our medical dental therapist, to have the same platform, the ability to have these collaborative meetings on a weekly basis. I think that this model is going to change medicine.
I agree with you on there for sure.
I don't know what the solution is, but
it's certainly keeping the healthcare field's focus on moving in that direction, I think, is important.
Yeah, definitely. Okay, 1, 2. I think you nailed it. I think awareness to clinicians and to these to this patient population is necessary, because these patients can't get the care they need if people aren't listening and they don't have the proper education. And I think the more we talk about it and the more we share, the better off this patient population is going to be.
Yeah. Agree with that as well.
Okay. Number 3.
Yeah. Number 3.
Okay. I think the last thing I want to end on is, so often with IDD patients and, their caregivers, conservators, everyone involved in their care, it gets exhausting. There is such thing as caregiver fatigue. I really just want to encourage you guys to keep going, to be an advocate for those patients. I think it gets exhausting sometimes, and you're just so tired. Like, should I continue doing it? Like, where is the end? Where is the light at the end of the tunnel? And there is a light. And I think just continuing to be an advocate for this, your loved one is my last one.
Keep advocating, and know that it's okay that you're going to be worn out and tired sometimes, right? So that's all right. Yeah. All right. Well, Meera, thank you so much for taking the time to talk with me today and for the incredible work that you're doing in the field. Thank you. Let's talk again sometime.
Okay.
All right.
Thanks.